Good day, friends, and a warm welcome to 4D, Detailed Discussion and Dialogue in Indian Diabetes. This is 4D 2.0, and it's episode 44, a special episode, because this is our diabetes and Diwali episode. Diwali and diabetes, can they go hand in hand? Yes, no, I don't know. I'm not sure. I want to find out more. Let's find out more how we can enjoy Diwali while living with diabetes in a healthy, in a happy, and in a harmonious manner. If this is what we set out to do, then we need experts who are happy and healthy and always in harmony with the world around them. So let's welcome two perfectly suited people for this happy, healthy, harmony kind of description. A warm welcome to Dr. Atul Dhingra.
Thank you and good evening, everyone. It's a pleasure to be here in
So,
this
Dr.
special episode.
Yeah. Dr. Atul, once I went to Western India and I went for a CME. So the best part was they had chairpersons, they had moderators, and then when I went up, they said, Daksa, why do you trouble us? Why don't you introduce yourself? So in a happy, healthy, harmonious manner, please introduce yourself. Where are you from? What do you do? What's the secret of your smile?
I'll start answering it from backwards. The secret of my smile is friends like you always keep me happy, even in the times of trouble. Um, I, I seek your advice, and that always keeps me happy. So I am Atul Dhingra. I am currently working as endocrinologist in Sri Ganganagar. So Sri Ganganagar is the westernmost part of the country. We are right across the border from Pakistan. I'm really happy to be around Dr. Kalra in this special episode.
Thank you, Dr. Atul, and we are all happy to have you with us. We have another happy, healthy, and harmonious person with us. A warm welcome to Dr. Sourabh Sharma. Warm welcome, Dr. Sourabh.
Good evening, everyone. Good evening, Sanjay Kalra, sir, Atul Dhingra, sir.
Hi,
So I'm happy to be here. A special episode on diabetes and Diwali.
Of course, you know, Dr. Saurabh, now the ragging is banned in the country and we should follow all these rules, but still, an intro would be in order, wouldn't it, for all of us?
Yes, sir. So I'm presently working as associate professor in nephrology at Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi, and I'm having special interest in transplantation and chronic kidney disease, especially diabetic kidney disease.
Thank you so much. Thanks, Dr. Atul. Thanks, Dr. Saurabh, for being with us, and thanks to everyone who is listening to us. Now, this challenge, can I enjoy Diwali? This is a challenge posed to us by each and all of our patients, and rightfully so, because there are so many fears and concerns about Diwali. So let's talk about these fears and concerns, the challenges, the complaints. Dr. Saurabh, an elderly person, a person living with chronic kidney disease, what is it that they worry about most during the Diwali season?
Yes, sir. So there are two categories of the people who are asking, sir. One who are on dialysis, and the second one who are not on dialysis. Like in my perspective, so diabetic patients with diabetic kidney disease on dialysis, the main concern is like on the day of Diwali or the day before or day after, there is the dialysis centers, they are closed because of the festival season. The dialysis technician is not there. So the biggest concern mainly in the government sector or even in the private sectors, in the peripheral centers, the concern is that where they will go if something happens to them, like if they develop dyspnea or if they have fluid overload, where they will go and get dialyzed. So that is the biggest concern for the patients who are on dialysis. For those not on dialysis, the concern is can we eat the food that has been prepared at our home during the festival season? How to cope with that? Like so, and second thing is how to adjust their medications while going through this kind of diet. So this is the biggest challenge, sir, in these two categories.
Thank you. And Dr. Atul, your comments, what are the biggest concerns and complaints that your patients come with pre-Diwali?
Yeah, the concerns again, like Dr. Saurabh said, is the availability. Those who are having brittle diabetes, those who are in constant touch with their physicians for managing their diabetes, and those who are on multiple doses of insulin. So they have a fear that they'll not be able to connect to their healthcare giver provider. Secondly, again, with the hassle and the festivities going around in the house, They are concerned that they'll not be able to take care of themselves. They'll be indulging in the food that is being prepared for the festival. And many of my patients do believe that post Diwali their blood glucose levels get uncontrolled because of not eating correctly, and they do feel guilty about it also. But we do give them a smile and this and say that you can enjoy the festivals, but probably with discipline. And I believe this is what we are going to talk about today. Third concern is especially my patients who are having some chest problems. They are concerned about their lung infections and their allergies being flared up. So just today I had a patient who was concerned about this, and we did advise him to wear the mask uh, throughout the next 7 days, 7 or 8 days. And she was worried because she was admitted with an acute attack of asthma last year, and she was put on steroids, because of which her blood glucose went haywire. Then she developed urosepsis. So you can understand the concern. It started with Diwali, developed acute flare up, ended up in a ICU with urosepsis. So these are the concerns that we usually.
So one is the healthcare system. We worry, will the healthcare system be able to respond to our needs during the festive season? The second is focus on diabetes care, especially on food, because that is what changes. And the third is beyond diabetes, other complications, which can be not only respiratory complications, but others as well, leading all the way up till sepsis and an admission in ICU. Maybe from a nephrology perspective or geriatric perspective, dehydration perhaps,
Yeah,
maybe a gastroenteritis because of food that is eaten outside. So
absolutely.
all these challenges and concerns are there. Let's talk about how to handle them, and let's go one by one. So we'll talk about food, and then we'll talk about beverages. So Dr. Atul, food. Uh, what kind of snacks are usually taken during diabetes? How can we make them healthy? You retain the essence of the festival, but you create low calorie, low glycemic index recipes. How do you do that?
So what I usually advise my patients is see, Diwali starts with D, and diabetes also starts with D. And if you just add a third D of discipline, discipline means you can enjoy a small amount of sweet or whatever is being made during Diwali, but that too in a limited amount. Don't eat the whole box of sweets. Just you can have small amount. And if you want to indulge, they can make recipes out of fruits. Like they can use curd and small amount of curd, and they can add fruits, and it can be made into a good dessert that they can enjoy. And then eating a lot of fibers before they eat carbohydrates also makes sense in this regard. And I also ask them not to take two carbohydrates together. So don't take sweets immediately after having a meal. Keep it separate. If you are able to do that, and taking small amounts at a time will help. And do check your blood glucose levels. If it's going haywire, then you have to make yourself more disciplined.
So a few P's coming out across from Dr. Atul, powerful P's. First is pre-fill. Pre-fill your stomach with fiber or maybe with fluid. So first fluid, first fiber. Take some salad. That is meal sequencing. The second powerful P is preparation. So instead of taking sugar, you might want to prepare a fruit raita. That fruit raita you can freeze as well, so then it becomes a frozen fruit raita, and very low in calories, low in glycemic index. You can involve the entire family, including the younger children, in preparing that, so they also feel very proud and happy. I was able to create a happy sweet dish, a healthy sweet dish for my grandmom. So that kind of a feeling you can inculcate in the children. Another P that you said is about partnership, and you said about not having two carbohydrates. But then usually, Dr. Saurabh, in the OPD, we get so tuned to patient comes and says, tell me about dietary restrictions. So we say, don't eat this, don't drink that, don't do this, don't do that. We forget to give alternatives. So, what kind of alternatives? So, Dr. Atul said, do not take two carbohydrates together. So, what can you take together? How do you talk about that in a proactive manner?
So in the food, like in my what concerns me while the patients coming to me in my OPD is some electrolytes which are harmful, like in these patients who are having kidney diseases, like potassium and phosphorus are the two most important electrolytes that harms the subset of people who come to my OPD. So the food I ask them to eat is those kind of food which are low in potassium and low in phosphorus. So I recommend them diet which has low potassium content. So some fruits which have low potassium content, like I tell them to eat papaya and apple, and they can make combinations of these with raita also, as you had already told. And the phosphorus content is high in the uh, fast food. So as we all recommend to not take fast food. So and the cold drinks are having uh, high phosphorus content. Similarly, in the festive season, they are the sweets, the chocolates, strawberries, different kind of berries. These are high in potassium, and the chocolates, these are high in phosphorus. So I tell my patients not to take these kind of sweets, and they can make sweet at home, like the classical sweet like halwa. They can make halwa at home, which is low in sugar content. And similarly, if we talk about the fluid, so there is a concept similar to the glycemic index in the food, that is beverage hydration index. So we talk about the beverage hydration index in these. I talk about beverage hydration index with my patients, and this is the BHI is used to assess the hydration capacity of some beverages. So some commercially available beverages like the cola, the cold drinks, whichever are available, the tinned or like the different tinned these juices. So these are having beverage hydration index. The beverage hydration index is the hydration capacity of the fluid, and it is in the terms of electrolytes and protein and fat. So and a fluid which is having high in electrolytes and low in protein and low in fat, and that is similar to that of the milk. So that has high beverage hydration index. So the classical drinks which are available in Indian context, like the buttermilk, so it has high beverage hydration index in comparison to the different commercially available beverages. So I always tell my patients to take the different beverages which are available in the villages, like buttermilk and different kind of beverages that are prepared in Indian context.
So thanks a lot. So we've learnt about, first of all, pre-filling. You want to take sweets, you want to take something that is high in calories. You pre-fill yourself with fluid or with fiber, with salad or with drinks. What kind of drinks Dr. Saurabh has mentioned? What is available traditionally to us, like buttermilk is a good idea. And he has raised the point of beverage hydration index. Now we all speak about glycemic index, but beverage hydration index is equally important. So just let's ask everyone a question. What do you think? You are eating or drinking a total of X amount of grams or liters, grams or ml per day. How much of it is water? How much of it is fluid? And how much is solid? So, Dr. Saurabh, is the fluid content more or is the solid content more in whatever we eat throughout the day? Which one is more? The fluid.
So in the as per beverage hydration index, the fluid content
Oh,
should be more. So
yeah.
as
Yeah.
compared to the
Total.
solutes.
Yeah. Right. No, no. The point is that total, whatever we eat throughout the day or whatever we drink, we are drinking more than eating. Dr.
So
Atul, is that true for Rajasthan as well? Rajasthanis drink more than they eat.
So I realized it probably a year or year and a half back when I had a sudden renal colic, and I actually analyzed my whole day beverage intake or water intake, and after that I actually made it a point. Now I pre-fill my bottles in the morning. So this is the amount of the water that I have to finish before I leave for OPD. This is the amount of water in the OPD that I have to finish. This is till the evening OPD and this before I sleep. So this is what I have
Then
started doing it. Yes, my personally my water intake was very less prior to that, but now yeah, I've started drinking
So
more.
actually, our fluid intake is more than our solid intake.
Yeah.
That would be true for virtually everyone. And then that beggars a thought: why is it that we spend so much of energy on glycemic index and not on beverage hydration index? One of the reasons is that Dr. Saurabh Sharma did not teach us earlier. So now in 4D, episode 44, he has made amends. So now at least we should begin reading about that, thinking about that, and speaking with our patients about PHI. So thank you, Dr. Saurabh. आपने हमारी आंखें खोल दी और डॉक्टर अतुल का रीना कॉलिक ठीक कर दिया. You fixed that up as well. So thanks. So that's one point. Beverage hydration index. During Diwali time, speak with your patients about water intake. Tell them to drink water. Water is boring. They can take buttermilk. A second point which Dr. Saurabh raised was that of micronutrients. So we always talk in terms of protein and energy, protein and carbs. We also talk in terms of mesonutrients. Macronutrient is protein intake. Mesonutrient is how much of animal protein, how much of plant protein. Macro is fat. Mesonutrient intake is how much of saturated fat, pufa mufa. Similarly, carbohydrates is a macro group, and in meso we have got simple carbs and complex carbs. So we do all that as doctors. We have a fair command over that, but we also should not forget the micronutrients, which is the vitamins, the minerals, and the electrolytes. So if you have a person who is at risk of kidney disease, who has hyperkalemia, then you have to be extra careful. And the points that Dr. Sharma has shared are very simple, yet very important. Another point was raised about halwa. So by definition now, halwa is something that is cooked in ghee, but kheer is something that is cooked in milk. So Dr. Atul, you've been an expert now in cooking for the family for how many years?
So I remember uh, cooking kheer for the first time. I believe way back in 2018 when I cooked it with Dr. Kalra for the first time, and we actually won a prize for that.
We won a MasterChef
Literally.
prize. Yes, that is my favorite prize. You know, it was a team. So Dr. Atul did the cooking. He created a low calorie kheer in Bangalore, and I did the cheering up. I mean, you have to have someone to clap for the chef, no? But we won the trophy together. I mean,
Yeah.
how can you create healthy kheers for someone living with diabetes?
So yeah, again, like we were discussing about that competition. So we actually made a millet kheer. So you can use that those options. You can use even the rice kheer that is being made can be used. I'm not a very big fan of artificial sweeteners. I'll rather restrict my calories by keeping the sugar content on the lower side, probably because I personally don't like the taste of artificial sweeteners. So it is open to debate. But yeah, there are multiple recipes available on use of millets and these are high fiber content. These have high fiber content, and actually, I remember the taste. It was really tasty.
So all you need to do is to add, put a little bit of milk, little bit of water, whatever you're putting inside. It can be broken rice. It can be maybe some kind of vegetables like simple gourd, which is used. You might want to put in cucumber or carrot. Do not add any sugar. And let's take Dr. Sharma's help. So, Dr. Saurabh, many patients with chronic kidney disease and with diabetes, many of them on DPP4 inhibitors, other drugs, on GLP-1 RA, they complain of loss of taste. And I'm sure that would be a big issue for you always. They complain that the diet that you have prescribed is very bland. They don't find anything tasty. So, what kind of spices can we use from the Indian kitchen which can bring back that taste, which can bring back the happiness of
So,
eating?
most patients ask this question, sir. And so my recommendation is to restrict salt. So salt restriction is the primary concept. And as per kidney preview, they can use every spice. Like there is no restriction on any kind of spice. So they can make their food more palatable with more spices and low salt. That is the advice we give.
So when they complain of issues with taste, first of all, you say, yes, I acknowledge, I appreciate that you have a problem. It can be because of long-standing diabetes and neuropathy. Yes. It can also be because of local infections, maybe a fungal infection. So maybe vitamin deficiency, uncontrolled sugar directly causing neuropathy. So first of all, you say you acknowledge, I understand. Then you say we have many etiologies. Let's fix them all one by one. But one etiology is that you've hypersensitized yourself with salt. You've taken desensitized yourself. You've taken so much of salt. Now all your taste buds have conked out. So, but you have to give alternatives. Remember that there always has to be an alternative for sugar, for salt, and for saturated fat. So let's do them one by one. For salt, the alternative will be asafoetida, in Hindi, hing, black pepper, green pepper, red pepper, whatever the patient likes. It can be
Ginger.
garlic or onion. Yeah. So these kind of spices you can use. You also might want to use another spice. The English word is licorice. The Hindi word is mulatti. That gives a sweetish taste to the oral cavity. But Dr. Saurabh, are there situations where you should not prescribe licorice to a patient? Any
Yes,
any adrenal or any renal diseases where you might end up masking or you might end up worsening a disease?
yes, sir. In the patients who are having this adrenal dysfunction, in those cases we ask them not to use licorice, and there are many cases in which licorice has been the culprit. So most of these patients, there are many case series also, sir, and we ask them not to use.
So, in case if your patient's electrolytes are normal and you do not expect any issue with hypokalemia, you can use licorice. But otherwise, if you are worried about electrolyte dysfunction, it's a good idea to avoid that. But other things are there that you can use. You can use cloves, you can use cardamom, you can use cinnamon. So remember these three. Dr. Atul, your favorite Punjabi song, what does this say to you? Tu long te main lechi. What does this say?
So we have buddies, like long and
Well done.
lychee and buddies in making a good tea. So we have the buddies together.
Yeah. So cloves, cinnamon, cardamom, these are things that you use. Many times in my OPD, I tell them while you're preparing the kheer or while you're preparing your tea, you put double elaichi. This is something that rolls off the tip of my tongue. So double elaichi or double cardamom, lots of cinnamon, buy good quality cinnamon. So your patients feel empowered when you tell them that our kind of cinnamon is different. The one that comes from Sri Lanka or South India is different. And you buy a quill, Quill. You've taught an English word to the boy or girl who's accompanying his or her mother, quill. You've told them, though, of course, in where I work in Haryana, people call it cigar. So when you go to the shop, you have to say cigar wali dalchini chahiye. That is a quill of cinnamon. And that is of better quality. You use that, you will actually find the taste of your tea or milk or kheer is so good, you will not need any artificial. So we've talked of alternatives to salt now. And alternatives to sugar have also come in, like cinnamon, like cardamom, maybe like clove. Artificial sweeteners you can use in limit. What about alternatives to saturated fat, Dr. Atul? The taste comes from butter, it comes from ghee. So how do you convert our taste buds, and what are the other options you can tell the patient?
Eh, you're right that the taste comes from the ghee, but there are techniques where we can limit the amount of ghee or oil. I remember from my childhood that when we have to make a chapati soft, you can either add a small amount of ghee in it, or you can use small amount of milk to make it to add the fat content to that flour to make the chapati or parantha softer. There are air fryers now available in the market where you can actually make it without using any amount of oil. You can change your technique of using oil or ghee. You can use a brush and you can just brush it on the cookware rather than putting a whole teaspoonful for making the dish.
So you can reduce the quantity gradually, slowly. You can replace when you're making the dough, you can replace with milk or even with curd. So we tell
Yeah.
our patients when you're cooking, when you're kneading the dough for chapati, you just add a little bit of milk or curd, maybe 10, 20, 30%, and then see what happens. The taste will become very good. You also might want to ferment the wheat flour, the atta. If you do a slight amount of fermentation, the taste changes. It gives you a tangy taste. And basically, it's about tickling the taste buds. So, A good cook will be able to utilize fermentation, whether of rice or of wheat. Any kind of carbohydrate can be fermented. So you can utilize fermentation as a taste enhancing process. But Dr. Saurabh, all this theory is fine, but finally your patient will come back and say, especially if it's a type 1 adolescent or anyone, old, young, Diwali is the same for everyone. They'll say, sir, there are so many mithais coming home. What do I do with all of them? Of course, one answer could be, why don't you bring them to the OPD next week? But apart from that answer, what else? How can they manage their health? How can they manage discipline in the midst of so many temptations?
So my patients, like I tell them that one day of extra sweet will not harm them. So I allow them, sir, most of the times. And I tell them to trade off the extra calories by exercise and by restriction the next day or the day before. And that concept I tell them. Apart from that, in this festival season, sir, like there is more stress because of this air pollution and the noise pollution, which also brings uncontrolled blood pressure to these patients, and most of them come with hypertension even on the daily medication they are using. So I tell them to like do some kind of stress buster or the physical exercise, as well as to improve their sleep hygiene.
So one is eat in moderation, and second is you increase maybe your physical activity, focus on sleep hygiene, focus on relaxation. Dr. Atul, there is something known as the glossopalatal maneuver. This comes from the Upanishad, to be specific, from the Maitri Upanishad, and it's book 6, chapter 20. This is one of the few things that I remember. My numeracy skills are also going down, so I do remember the date of Diwali, and I do remember book 6, verse 20. So the glossopalatal maneuver says is what it says. The Upanishad says that you press the tip of your tongue on your palate. So that's glossopalatal. Now, maneuver, the spelling of maneuver can vary from place to place and person to person. Where I did my MD, we had 10 different spellings for Daniel. So you can have 10 different spellings for maneuver, but still it works. So why don't you try it all, everyone who is listening? Press the tip of your tongue on the palate and see what happens. You can do a proximal, and I see that Dr. Saurabh is trying that very hard. You can do a
Yes.
proximal glossopalatal maneuver. You can also do mid glossopalatal, and you can do distal glossopalatal. The Upanishad says that if you practice this, sache dil se, with all your heart, then you reach Brahman. That is what is written. Now, the definition of Brahman is also open to conjecture. But first, Dr. Atul and then Dr. Saurabh, this glossopalatal maneuver, how does it sound as a kind of a adjunct therapy for diabetes and blood pressure?
Sounds interesting, but this is new, actually new for me, and I learned it from you today, and probably for next few days I'll try to understand what it does to me.
Dr. Saurabh, your comments. Please take a break from that maneuver. Lot entire India is listening to you now.
Sir, like I have never recommended this maneuver to my patients, but I think that it will help them relax their to improve their satiety. I think so, sir.
So it's not just about religion or spirituality. Of course, our context today is Diwali, and we've quoted the Upanishad. But if you quote the Upanishad, you may be sort of criticized for being hyper religious, for being pantheistic. But see, it's a physiological maneuver. Dr. Atul, when you try this glossopalatal maneuver, what would it do to your adrenergic system? What would it do to the vagal tone? What do you think would be happen? What would happen to glucose metabolism?
So what I believe is it will increase our vagal tone, uh, thus reducing our adrenergic response, and probably reducing our insulin sensitivity, increasing our insulin response, and improving our insulin sensitivity as well. So this is what I believe it should be doing by strengthening our vagal response.
It might also, if we work very hard, it might reduce our food intake as well. Even if you're able to avoid
Yeah.
one or two unhealthy snacks out of 10, even that is an improvement. Dr. Saurabh, same question from a blood pressure perspective. Somebody coming to you with borderline resistant refractory hypertension, what would this maneuver do to their vascular health?
Yes, sir. It will improve their autonomic function, and also it will help reducing their blood pressure. So I think along with the medications, this maneuver can help them relax and help improve their blood pressure and also their stress, help reduce their stress also.
So our topic is diabetes and Diwali, but now suddenly we realize that the entire Brahman, the entire universe is ours for discussion. And that is the beauty of 4D. It's a detailed discussion in diabetes in Indian, discussion and dialogue in Indian diabetes. And it's important that we get together, we talk about this, converse about this, so that we can share the broader message of health and harmony with our patients, with the public at large. Let's conclude on a happy note. It's Diwali now coming up. So, Dr. Atul, what would be your favorite dish? Diabetes friendly, glucose friendly kind of a dish for Diwali.
So yeah, like I started telling, my favorite dish is made of curd and pulses. It is dahi balla. So that is what I relish during Diwalis. And if you want to relish it, definitely my diabetic patients can take it. Just like I always say, in discipline, use the don't indulge in it. Yes, but you enjoy your festival.
Great suggestion, dahi bhalla, and you top it up with various spices, with
Mm,
nuts. You will not need any sugar or any sweet condiment and all.
definitely, yeah.
Same question, Dr. Saurabh, your favorite dish? Diwali coming up now.
Sir, my favorite dish is what my daughter likes, and I enjoy uh, relishing it with my daughter. It's dal ka halwa that I relish, sir.
So dal ka halwa, good idea, and maybe in moderation. If we can convert into a kheer, of course, it would be difficult to make a dal ki kheer, but you can always try a millet kheer, which won Dr. Atul Dhingra the Master Chef of the country award. Diabetes Master Chef, yeah. So we can try preparing different kinds of kheers. What I would suggest is, and I'm inspired by that beautiful flag behind Dr. Atul, that is that we create a patriotic plate for ourselves. So the flag of India has four colors, and we are very proud of it, of our flag and these four colors. Each and every plate should have four colors. So that means colored vegetables, colored salads, and colored fruits. You use those whole fruits, not fruit juices and not fruit smoothies. So the more color you have on your plate, the more colorful your life will be. And then that's a very nice, a very patriotic, and a very simple message to give across to our patients and their family. Let's move on with this questioning. Dr. Atul Dhingra, your favorite beverage for Diwali season? This is a Sharif question. It is not a naughty question.
So uh, my favorite beverage usually it is buttermilk. So like Dr. Saurav was saying, I relish buttermilk, and especially that is being made by churning the milk, not churning the curd. So which I usually get from my patients from the villages. So that is what I enjoy a lot.
And Dr. Saurabh, your favorite beverage?
Sir, during Diwali season and also other festivals, my mother prepares kanji vada. So that kanji ka pani, that's my favorite, and it's low in salt. So I consume it.
So kanji from Rajasthan and kokum juice from Konkan, from Goa. These are very nice beverages that you can promote during the Diwali season. Try to promote things that are traditional. My favorite would be haldi wala doodh, which is turmeric milk, which is
Yes.
our Haryana staple, and we use it for each and everything. It helps us prevent disease, it helps us cure disease, and so turmeric milk is what I would advise everyone. But I have a question, Dr. Saurabh. Why is it that everybody begins laughing when I ask questions?
This question, sir.
Yeah, the question is, why does Atul Dhingra always laugh when I ask questions?
So this question was regarding beverages, and there might be some other kind of beverage that sir likes and don't want to discuss on this platform. I think so.
Which is a fair point, though. Okay, it was a good guess, but Dr. Atul, is that right?
So I always find a hint of naughtiness in your questions. Probably I've been with you for
It's
more
about
than a decade.
perception. So you see, though nothing was naughty, I mean, it's just about perception. I don't know why I'm always perceived in that manner. So there was nothing naughty, and there is nothing naughty in. I know that Dr. Atul has not hidden anything, so he gave the truthful and the full truth answer. But the point about perception is how are we perceived by our patients? If you are going to be perceived as an obstacle towards enjoyment, as an obstacle towards happiness, the patient is never going to be friends with you. If you just change your perception and you begin perceived as a human being, I personally feel if I were to go to Dr. Atul or Dr. Saurabh to take treatment for anything, if any of us were to uh, reach out to each other for professional help, the first and foremost thing that we would want is the person in front of me is a human being. He is humane. He is available. He is affable. It is only after that then that we begin talking about ability and how much you've studied and how much of genetics you know and how much of latest biochemistry you know. So if we are able to be perceived as a person who is promoting enjoyment in Diwali, automatically we will end up promoting partnership and we will end up promoting companionship, fellowship with our patients, with our fellow citizens. So, Dr. Atul, as we part now, any comment the last week in your OPD? Maybe you burnt your fingers with the wrong communication, or maybe you were able to use communication as a means of helping your patient smile and feel happy living with diabetes.
So, if I talk about my patients, yeah, uh, uh, I remember one of my patients. Uh, so the patient was brought to me by his by her grand child. What we did was the patient was not agreeing to take insulin, and the lady was not agreeing to take insulin, and we taught her grandchild how to inject insulin. we told her we told our patient that he's the one who is going to inject you, and probably he might be motivated one day to become a doctor himself by taking care of you. So this was one of the motivating factors for that lady, that mera pota doctor banega. So this actually helped us, and this is the one communication which I distinctly remember from last week, where we were able to
Into
start.
insulin. And to add to that, the thing is that we want your grandson to become a doctor and we want to dance together at his wedding. So that's why you need to take the insulin and the ACE inhibitor and the Finrenone.
Yeah.
Sometimes the lady will say, "Oh, but I won't live that long." And then I counter, I say, madam, you don't want to give me a box of mithai at your son's wedding. So sometimes my tone is, not being offensive to anyone, but sometimes my tone is actually, "Sone ke toppers milenge. You will get gold earrings." So it's a way of breaking the ice. And many times I say, I want a box of mithai at your grandson's wedding. So both of us have to live that long. And if you're going to cheat on me, that's not fair. So thanks, Dr. Atul, for raising that. Dr. Saurabh, in general, in the diabetes OPD, it's usually like a well baby clinic. So, most of the people are happy. But a nephrology clinic is supposed to be grumpy and grouchy and full of disgruntled people. Is that right? That's the first question. Second question is, how can you use your conversational skills to convert disgruntlement into gruntlement? Gruntlement means happiness. How can you use your communication to convert sort of dissatisfaction into satisfaction?
Yes, sir. Sir, as you have rightly said, most of the patients in our OPD. So there are three kind of OPDs, sir, in nephrology. One is the transplant OPD, one is glomerulonephritis, and one is the chronic kidney disease. So most of the patients in transplant and glomerulonephritis OPD, they are well satisfied. The most dissatisfied patients are in CKD, chronic kidney disease OPD, which are on multiple drugs, and so they are dissatisfied. But there are many patients who are like in acute kidney injury, who come in acute kidney injury, who are being referred from different clinics with creatinine of 1.7, 1.8, and we ask them, we feel that it's a AKI, and we ask them to repeat their KFTs in next clinic, next OPD, and next OPD their creatinine comes normal. So that kind of happiness they shows that they reflect. So that is very charming, sir. And second thing is like when we reduce the burden of polypharmacy to these patients. Like many patients who are on 8 or 10 drugs, and when we reduce it to 3 or 4, uh, either by many aspects, like we can uh, combine two drugs in single one pill, 2 or 3 drugs in one pill, or we can reduce the drugs which are not needed. So that brings happiness, and it increases the satisfaction and brings a smile on the patient's face, that I feel.
Dr. Atul, you have coined and used the word insulin distress in many places, and Dr. Saurabh Sharma has coined the word dialysis distress. So perhaps we can conclude, is there something like Diwali distress? That's what we began with right at the beginning. Is there something like Diwali distress in Indians living with diabetes? Yes or no? And one single tip as we take leave of our audience, and so that we allow everyone to enjoy their Diwali with their loved ones.
So yeah, definitely, I believe the Diwali distress is definitely there, not only in the patients but more so in the care providers, caregivers who are providing them with the care at the home. I believe they are the more who are distressed because they believe that they will be overwhelmed with the preparations of the festival, and during this time they believe that they have to be more stringent to take care of the of the of the patient. But what I tell them is, like you said, that he's a person, he's a person, and Diwali is also for him. So do not just shun him from all the festivities, let him also enjoy the festival. And what I tell the patient is, do enjoy the festival, because this is what makes you alive, but do it in discipline.
Can we use, Dr. Atul, can we use a tablet of Voglibos every now and then when you know that a high carb meal is being taken?
Yeah, again, a very good option that we definitely use in our OPD. We do tell them that if they are snacking, then they can use a carbos or Voglibos, whatever you prescribe.
Dr. Saurabh, as we conclude, Diwali distress, is this common in your patients and in their caregivers? Are we guilty of not having paid enough attention to it? Do you think we've done whatever we could today through 4D, episode 44?
Yes, sir. Like Diwali distress is common in both the patient and the caregiver. In different aspects, the patient feels that he will not be able to enjoy this festival. He will be a burden on his caregivers, that the patient feels like, in terms of the meals that will be prepared at the home. It will be as per his the guidelines that he needs to follow. And second thing is like the crackers and the pollution in the air, or in the noise pollution. He feels that he will not be able to uh, pass the following coming days. That is the feel in his mind. In the caregiver's mind, the fear is, the distress is, that how they will be able to take care of the patient in the coming days of the festivals, and how because there will be many guests who will be coming, and they will have to prepare the meals accordingly, and they have to take care of the patient also. So both ways, both of them are having equally, they both get equally distressed. So, by the today's talk, sir, we have concluded that the Diwali distress, or the Diwali and diabetes, that can be uh, that these patients can also enjoy fruitfully, and one day of extra meal, or one day of pleasure, will not harm them to the way they are thinking of. And so they can well prepare of the festival in advance, and accordingly they can be equally they can equally enjoy the festival as a normal population.
Thank you so much, Dr. Saurabh, Dr. Atul. Uh, Thanks everyone who was logged in today. This is our Diwali special episode, and we've moved from Diwali distress to Diwali enjoyment with enthusiasm, health and happiness, and harmony. This is something that we can all achieve. All we need to do is to speak more about such things, about feasting and fasting in diabetes. The more we converse, the more we learn from Dr. Dhingra, from Dr. Sharma, and also from our patients and their families. So here's wishing everyone a beatific and a bountiful Diwali, praying for peace and prosperity throughout the world. I hope Dr. Atul and Dr. Saurabh join me in praying for peace and prosperity. Thank you, everyone. And